Healthcare professionals like physicians, nurses, technicians, and pharmacists must work collaboratively to ensure that patient care is safe. While the care these healthcare workers give requires collaboration and teamwork, they are seldom trained together. Instead, they are educated and trained in their separate disciplines and then are forced to work together as a team, lacking the knowledge of effective collaborative teamwork. When healthcare teams are not functioning well, it increases the risk of medical errors that can cause significant patient harm. Medical errors affect millions of patients each year. In fact, 1 in 17 hospital stays in Canada result in at least one harmful event, most of which are preventable. Collaboration and teamwork are crucial to patient safety. When team members are committed to cooperate, coordinate, and communicate, they make fewer mistakes and keep patients safe. However, merely putting a team structure in place does not ensure the team will function well. Teams must learn how to work together and be willing to sustain those efforts over time. This presentation aims to give you a general understanding of interprofessional collaboration and how it affects patient safety. First, we'll review the concepts of patient safety and interprofessional collaboration and how these concepts are related. Then we'll discuss some facilitators and barriers to interprofessional collaboration and patient safety, and we'll conclude by outlining some interventions for healthcare teams that have been proven to successfully improve interprofessional collaboration and enhance patient safety. Let's get started. Patient safety, or to do no harm, is the fundamental principle of high-quality healthcare, but the overall goal of patient safety is to minimize avoidable harm to patients. As you can see, the World Health Organization defines patient safety as the absence of preventable harm to a patient and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. Some of the safety strategies used by healthcare providers include hand hygiene, personal protective equipment, team rounding, and safety checks. However, despite these measures, patients continue to experience unintentional harms such as medication errors, hospital-acquired infections, misidentification, and malpractice. In developed countries, it is estimated that 1 in 10 patients experience harms like these during their hospital stay, costing governments between $6 and $29 billion each year. Health Excellence Canada is one example of a collaborative effort aimed to improve patient safety. This nonprofit organization collaborates with patients, partners, and healthcare providers to influence policy for high-quality healthcare and enhanced patient safety. Let's explore collaboration a little further. Interprofessional collaboration is the partnership between a team of health providers and a client in a participatory, collaborative, and coordinated approach to shared decision-making around health and social issues through constant communication, cooperation, and trust with one another in achievement of a shared goal. In healthcare, collaboration between disciplines promotes efficient, responsive, innovative, and holistic care. Interprofessional collaboration also increases access to care and improves coordination of care services, all of which are crucial to patient safety. In healthcare settings, interprofessional collaboration occurs through regular team rounding, consultations and referrals, shared decision-making, and unit-based counsel. As you can see from this diagram, there could be many healthcare professionals collaborating on the care of just one patient. Patient safety metrics, such as complication rates, medical errors, length of hospital stay, caregiver conflicts, staff turnover, and patient mortality rates, all improve with a collaborative approach to care. But there are many facilitators and barriers to interprofessional collaboration that subsequently influence patient safety, so we'll discuss some of those next. Firstly, team dynamics are a facilitator for interprofessional collaboration. Team dynamics are how team members relate and interact with one another, which affects their performance. When team dynamics involve a shared positive attitude toward the safety of patients and the strategies used to ensure patient safety, it creates a patient safety climate. This type of dynamic effectively reduces preventable negative outcomes, such as medical errors that harm patients. Collaborative leadership, together with workplace social capital, are further facilitators of interprofessional collaboration. Leadership is the coordination, communication, and collaboration of team members, whereas workplace social capital is the networks and connections made within the workplace. Together, these factors facilitate the cultivation of reciprocal, trusting relationships through cooperation and teamwork. Trusting relationships also improve team dynamics and contribute to the patient safety climate, which reduces patients' harms. Positive work environments increase job satisfaction and retention of healthcare workers and is also a facilitator to interprofessional collaboration. A positive work environment involves quality interpersonal relationships, strong organizational supports, and efficient coordination between team members. This environment improves healthcare workers' motivation, performance, and collaboration, which enhances care quality and patient safety. Lastly, communication is a crucial facilitator to interprofessional collaboration. Effective communication involves sharing information that is adequate, relevant, and timely, and it involves active listening. This ensures that each team member understands the issue and is on the same page. It also allows for greater conveyance of patient issues to improve patient safety. Quality communication also fosters positive work relationships that facilitate interprofessional collaboration. Just as effective communication is a facilitator to interprofessional collaboration, ineffective communication is a significant barrier to interprofessional collaboration. Failure to communicate effectively can cause fragmentations and omissions in the information being shared. This results in misunderstandings and conflicts between team members that negatively impacts patient care and safety. Ineffective communication can lead to medication errors, delays in cares, falls, increased infection rates, and longer hospital stays. A lack of role clarity within the team is a further barrier to interprofessional collaboration. This is when team members disagree on or are unsure of their own job and responsibilities and those of other team members. Role confusion can be caused by overlapping scopes of practice between the disciplines, ineffective leadership, and changes in the organizational structure. A lack of role clarity can cause conflict between team members, reduce productiveness, and reduce the effectiveness of care. For instance, services can be duplicated, they can be inappropriate, or even omitted, all of which impact patient safety. Poor management and leadership styles can also act as barriers to interprofessional collaboration. Ineffective management and leadership includes micromanaging staff, conflict avoidance, a lack of accountability, assigning blame, and playing favorites. This leads to dysfunctional work dynamics that increase patient harms, but it also fosters mistrust in management, which impedes the reporting of patient safety issues. Lastly, negative work environments are barriers to interprofessional collaboration. Negative work environments include intense workloads, time pressures, inadequate staffing, harassment, poor leadership, a lack of organizational support, and occupational overload. These factors impact the physical, psychological, and emotional well-being of healthcare practitioners and results in fatigue, frustration, and burnout. It's difficult for team members to work collaboratively when they're not functioning optimally as individuals, and unfortunately, this also affects the care they provide. In fact, higher rates of unsafe care and the occurrence of patient harms are linked to negative work environments and poor working conditions. As you can see, interprofessional collaboration and patient safety have a direct correlation. As interprofessional collaboration improves, patient safety also improves, and as interprofessional collaboration suffers, so too does patient safety. So, if our goal is to enhance patient safety, improvements in interprofessional collaboration must be made. We'll explore some interventions that improve interprofessional collaboration next. One of the most effective ways to improve collaboration within healthcare teams is to implement team training intervention programs. These programs focus on the factors essential to team functioning like leadership, communication, professional structures, and team support. When successfully implemented, these programs improve team collaboration and team performance, but most importantly, patient safety. There are many different healthcare team education and training programs available, and we'll review 2 of those now. The Team Strategies and Tools to Enhance Performance and Patient Safety Program, or TEAM STEPS, is an evidence-based curriculum proven to improve collaboration and teamwork within healthcare teams to promote patient safety and safe work environments. This program offers education and training through a mix of learning modules, videos, scenarios, case studies, simulation exercises, and workshops. Let's discuss this in a little more detail. The main emphasis of team steps is on defining team skills, demonstrating strategies to build proficiency in the program's core competencies, as well as strategies to overcome barriers. As you can see from this diagram, safe, efficient, and patient-centered teams are the program's goal. Then there are 4 core competencies used to achieve this goal. The first competency is communication. This is the sharing of information between team members. Strategies include SBAR for critical information and handoffs for patient care transfers. The next competency is team leadership. This is the communication, coordination, and collaboration of team members. Strategies include briefs, which are quick pre-shift planning sessions, huddles, which are ad hoc meetings to assess and adjust the plan, and debriefs, which are quick post-shift discussions to improve team performance. The next competency is situation monitoring. This is a process that cultivates a shared mental model to ensure that each member is on the same page. Strategies include the I'm safe checklist to assess individual capacity to perform safely, and cross-monitoring, where members watch out for each other to ensure safe practices. The last competency is mutual support. This is when team members help each other out. Strategies include being willing to seek and offer assistance, providing constructive feedback, and advocating assertively when patient safety is at risk. Encircling the 4 competencies are the team-related outcomes of knowledge, attitudes, sustainability, and performance. You can see how that purple bleeds down through the puzzle pieces to the program's goals. This represents the dynamic interactions between outcomes and competencies that produce safe, efficient, and patient-centered teams who then deliver safe, quality care. So does this approach really work? There are numerous studies and systematic reviews which report overall that the Team Steps curriculum enhances interprofessional education and collaboration, improves the culture of safety in organizations, and improves patient safety and satisfaction. And where refresher courses were offered, the overall improvements were sustained at least 1 year later. Most importantly, healthcare providers reported that the program helped them to gain a sense of value for improved collaboration and how it relates to patient safety outcomes, and that they even enjoyed the training. This tells us that Team Steps has a direct positive impact on interprofessional collaboration and patient safety by improving teamwork processes. Now we'll review another team building intervention. The healthcare system is frequently changing, increasing the importance of patient safety and interprofessional collaboration. The use of simulations is one method aimed at reducing harmful errors that arise from unclear instructions and poor team communication. In healthcare, simulations are used to educate, assess, research, and integrate health systems for the promotion of patient safety. Simulations can be used in educational institutions to teach students and future healthcare professionals interprofessional education in safe and collaborative environments. Simulations also allow students to increase their critical thinking and procedural skills in a variety of methods, such as virtual reality, role-playing, and using full-body mannequins. Next, we'll discuss in further detail 2 examples of simulation learning exercises and their impact on interprofessional collaboration and patient safety. The first example is known as multidisciplinary simulation-based team training, or MDSBTT. This has been used in multiple healthcare departments, including critical care, trauma surgery, labor and delivery, and many more. One of the highlights of MDSBTT is that it allows collaboration to be strengthened by simulating common real-life situations while allowing professionals to remain in safe environments. Research studies conducted at the Queens Trauma Center, Stanford University, and the University of New Mexico's Emergency Medicine Department showed an improvement in teamwork and greater performance following MDSBTT simulation training. Unfortunately, the study also showed that when the teams stopped using simulations, the improvements began to decline. This demonstrates the importance of continued simulation training. MDSBTT has been proven to decrease mortality in labor and delivery and can be used to prove that a department operates safely prior to accepting patients. It can also be used to simulate risky real-life situations, to establish departmental best practices for safety in the community, to close the gap between medical staff, and to facilitate interprofessional collaboration. In the future, MDS-BTD can be used to improve outcomes in patient care and can be a part of healthcare departments for essential training of professionals. The second example of simulation learning is a research study that examined the collaboration between undergraduate nursing and medical laboratory science students through simulation exercises. These two groups of students worked together but did not undergo much simulation-based training prior to the study. The results showed an increase of knowledge of role clarity as the students were able to see what the other group's roles were during the simulation, an increase of confidence that arose from the use of uncommon situations and uncommonly used skills in the simulation, and an increase of awareness of patient safety and communication during stressful situations that involve team members and a stressed out patient. Both groups were able to learn more about the other profession. For instance, the nursing students gained an understanding of why certain tests take time to complete, and the medical laboratory students gained a new appreciation for timely test results as they were able to see how the patient's health worsened while waiting on test results. This study demonstrates the importance of simulation learning. So what are the implications of simulation exercises? In both methods of simulation learning, the study participants discovered that their communication and teamwork skills improved after completing the simulation. Patients were able to receive more patient-centered care, harmful errors were reduced, and participants gained a greater understanding of each other's roles and responsibilities. In many cases, the participants of simulation learning had a better understanding of the importance of communication to enhance patient safety. We can clearly see that as a result of both interventions, the Team Steps program and simulation exercises, that healthcare practitioners functioned better as a team, medical errors were reduced, and patient safety outcomes were increased. Now that we've reached the end of this presentation, you should have a better understanding of the relationship between patient safety and interprofessional collaboration. We reviewed the concept of patient safety and interprofessional collaboration as well as the relationship between them. We also discussed some of the facilitators and barriers to effective collaborative practice and provided some examples of education and training programs that improve team functioning, which in turn enhances patient safety. Throughout this presentation, we have learned that although healthcare teams strive to keep their patients safe, when they're unable to work collaboratively, they put patients at a significant risk for harm. However, when healthcare teams function optimally through collaboration, they are better able to keep their patients safe.